Let's go live to a GP surgery in Bulwell in Nottingham. Our correspondent Becky Johnson is there. Becky, you're there because they have been struggling to cope.
Yeah, good afternoon. This one of many GP surgeries across the country where there are no computers. So you can see reception pretty busy. They had no record of who had appointments today. They were simply relying on patients turning up at the right time. The phones even went down here on Friday. Luckily, the phones are back up today. But really, the message is to patients, you know, if you don't need to be here, please try not to come because life is extremely difficult for the doctors and the staff here. Let's bring in one of those doctors, Dr. Andrew Foster. No computers, no records. This is making your life incredibly difficult. Could you tell us about the practicalities of how your job's been working today?
Yeah, well, I understand the situation is very different up and down the country, but here the situation right now is that we don't have any computer access at all. We were asked on Friday to unplug our computers and leave them off, and we haven't yet had the green light to switch them on again. This has really plunged us back into the age of pen and paper. As you say, we have no records of who had appointments today. We have no access to our electronic record systems, so we're unable to process any patient queries regarding repeat prescriptions, results, letters from the hospital. So it's very difficult to provide care, but we are doing our best.
And what's the impact of all this on patients? We can see your reception area is pretty busy as people are trying to make appointments in person.
Yeah, well, I mean, we called in all our staff for an emergency meeting at 7:30 this morning to try and get prepared for what we knew was going to be a very chaotic day. So we do have a plan in place. We're reconstructing our patient ledger on a whiteboard in the back to avoid double booking and make sure everybody knows what they're doing. We've reverted to using pen and paper to record patient consultations. We're doing handwritten prescriptions. We're doing the very best we can.
And I've seen you writing notes on paper. Of course, when the computers are back up and running, that's all going to have to be put into the computer. So what's the backlog likely to be? You know, how long is this likely to have an effect on you and your staff and your patients?
Well, I think the longer the current situation continues, the bigger the backlog will be. But we could be looking at certainly a few days, possibly even running into weeks, depending on how long the situation continues, during which time we'll be processing all of the written records that we've made over the last few days, and those need entering onto the computers. So it's important that patients bear with us both today while we have the acute situation, but also in the days coming when we'll be processing a large backlog of work.
So a huge impact on you. And when you hear that NHS Digital did make a security patch available to NHS hospital trusts last month, does that make you feel like you want to point a finger of blame in any direction?
Well, I think there's a lot of questions that are going to be asked about how we got to this point, and that'll play out in the media in the fullness of time. My focus today is to make sure that we continue to deliver the best care that we can for our patients going forwards. But yeah, there are some serious questions to be asked.
And who do you think needs to be asked those questions?
I think responsibility could lay at a number of levels. I think those questions do need asking locally of our own services, and questions need to be asked right up to the top. You know, I think that we need to be looking for strong and stable leadership from our Secretary of State for Health, and I gather that's sort of only just become available earlier today. So yeah, lots of questions to be asked and answered.
All right, Dr. Andrew Foster, thank you very much indeed. So just one of many GPs dealing with this and having to still provide care under very difficult circumstances.
Becky, thanks very much.